Good morning, everyone, and welcome. We will get started in just a minute or so. Okay. Again, good morning and welcome, everyone. Our webinar today is Introduction to Building Capacity for Effective School-Based Suicide Prevention, Applying the NIATEX Model of Process Improvement for Sustainable Change. Our presenter today is Tandra Rutledge. The webinar today is brought to you by the Great Lakes MHTTC and SAMHSA. The Great Lakes ATTC, MHTTC, and PTTC are funded by SAMHSA under the following cooperative agreements. Just a quick reminder to everyone that September is Recovery Month, so you can go to Faces and Voices of Recovery to see what activities might be in your area, as well as any of the TTCs to find out what events are happening in your region. The opinions expressed in this webinar are the views of the speaker and do not necessarily reflect the official position of DHHS or SAMHSA. The MHTTC network believes that words matter and uses affirming, respectful, and recovery-oriented language in all its activities. Some housekeeping details for you. If you are having technical issues, please individually message Christina Spanbauer or Stephanie Bellman in the chat section at the bottom of your screen, and they will be happy to assist you. If you have questions for the speaker, please put them in the Q&A section at the bottom of your screen so that we don't miss them in chat. A copy of the PowerPoint slides as well as a recording and any handouts would be available on the MHTTC website in about 2 weeks. You will be directed to a link at the end of this presentation to a very short survey. We would really appreciate it if you could fill it out. It takes about 3 minutes and it's how we report our activities back to SAMHSA. We will be using automated captioning during the presentation today, and certificates of attendance will be sent to those who attend the full session. They will be sent to you via email and usually take a week to 10 days. If you would like to see what else we're up to, please follow us on social media. Again, our presenter today is Tandra Rutledge. Tandra is the Director of Business Development at River Edge Hospital, a freestanding psychiatric facility in Illinois. Tandra is a mental health advocate and suicide prevention educator. She promotes wellness and resilience through social justice and the racial equality lens. Tandra serves on the board of directors for the Illinois chapter of the American Foundation for Suicide Prevention and is a member of the Illinois Suicide Prevention Alliance. She is an AMSR trainer, a certified suicide prevention educator for the QPR Institute, an adult mental health first aid instructor, and crisis intervention team instructor with the Chicago Police Department. So we are excited to have you with us, and I will turn it over to you.
Thank you, Anne, and good morning, everyone. Thank you for joining us for our webinar this morning. I am really excited to be with you all this morning. And just one correction, the last time we worked together, I was working at River Edge Hospital, but now I am in a new role with the American Foundation for Suicide Prevention, where I am the Director of Healthcare Systems Initiative for the American Foundation for Suicide Prevention. So just a little update to my current role. And I want to thank you all for taking time to join today's webinar. Our webinar today is entitled Introduction to Building Capacity for Effective School-Based Suicide Prevention, Applying the NIATEX Model of Process Improvement for sustainable change. In this introductory webinar, I will be highlighting SAMHSA's Preventing Suicide, a toolkit for high schools, and highlighting the strategies outlined to help school districts prevent suicide and prioritize mental health for all students. You will also have an opportunity to learn about a year-long school-based suicide prevention learning collaborative that will utilize the NIATEC model of process improvement to assist school districts in their efforts. So why is this important to me? Well, for my entire professional career, I have worked in community-based mental health and suicide prevention. And I can't count the number of times a local school or a community has been impacted by a suicide attempt or death. As part of the response team, I became increasingly aware that schools and communities were not prepared to respond. And oftentimes, their response to these crises perpetuated stigma and caused unintended harm to those affected by suicide. As a therapist and a mother of 2 school-aged boys, I decided that educating schools and working with them would be a priority for me. And I want to thank the Great Lakes Mental Health and Technology Transfer Center for their support and for the opportunity to scale up the work we are doing with schools. Before we begin, I would like for us to make a few commitments and agreements. First, I want us to acknowledge that suicide is a complex health-related outcome that is devastating and deeply personal for many of us. Many of us are survivors who have lost students, clients, friends, and relatives. Some of us even struggle with suicidal thoughts or know someone who does. And some of us may in fact be attempt survivors. So I want us to agree that during our time together this morning, that we will avoid blaming ourselves or holding ourselves responsible for what you might have done, didn't do, what you said or didn't say, based on what you learned today or in the future. Most of us are not trained in how to respond to someone who is suicidal. And with that being said, one of the most important things that you can do is to remember to take good care of yourself, to prioritize your self-care. Focus on the things that bring you joy, that make you laugh, that bring you happiness, and that keep you healthy. So we have several learning objectives for our time that we'll be spending together this morning. The first one is we're going to learn about the key components of a school-based suicide prevention plan. We're going to talk about some strategies to keep in mind in order to respond to the cultural and linguistic needs of students in your school district. We will have an opportunity where you can reflect and you can assess your current school district's initiatives and policies around suicide prevention and determine your readiness for change. And then finally, you'll have the opportunity to learn about an upcoming project that we have, a learning collaborative with school districts that will apply the NIATEC model of process improvement to your district's current suicide prevention efforts. First and foremost, youth suicide is a major public health problem in the United States. And according to the CDC, suicide is the second leading cause of death for youth ages 10 through 24. We're going to start by taking a look at the scope of the problem of youth suicide. The Youth Risk Behavior Survey is conducted by the CDC with high schools in the US every 2 years. And so you're looking at the most recent results from 2019, and these results reveal that we've made little progress in mental health and suicide-related behaviors and experiences as reported by students over the past decade. Unfortunately, most indicators of mental health and suicide have shown increasing trends, which is of great concern. So in summary, we know from the most recent results that more students experience persistent feelings of sadness or hopelessness, from 2009 through 2019, regardless of race or ethnicity. We also know from the data that more than 1 in 3 students and nearly half of female students reported persistent feelings of sadness or hopelessness in 2019. About 1 in 5 students seriously considered suicide. More white students and Black students seriously considered suicide from 2009 through 2019. We also know from the data that more students made a suicide plan from 2009 through 2019. And female students were nearly twice as likely as male students to make a suicide plan during 2019. Additionally, more female students attempted suicide between 2009 and 2019, and more Black students and white students attempted suicide during that same 10-year time period. And finally, more female students seriously considered attempting suicide and were injured in a suicide attempt from 2009 through 2019, and more male students seriously considered attempting suicide from 2009 through 2019. Unfortunately, it is not uncommon for young people ages 15 to 19 to feel sad and hopeless and to think about suicide. But keep in mind that it is less common for youth to act on their thoughts and attempt suicide, and even less common for them to die by suicide. We also know from research that suicide can be prevented. This does not mean that all suicides can be prevented, nor that suicide is a predictable event, but it does mean that through employing public health strategies such as universal education, community-based initiatives, including school-based activities, effective treatment, and better surveillance of suicide attempts and deaths, suicides can be prevented. These data trends also highlight student behaviors and experiences where increased support from schools, communities, and families is needed. We also know that suicide does not discriminate. It impacts all racial and ethnic, geographical, gender, socioeconomic, and age groups. However, there are some groups with higher rates of suicide. Middle-aged and older white males and young American Indian males are demographic groups with the highest suicide rates in the country. Other groups such as Black children and adolescents, Latinx female adolescents, and Asian American youth have higher rates of attempts. Additionally, lesbian, gay, bisexual, transgender, and questioning youth are at a higher risk for thinking about and attempting suicide. We also know from the research that there are geographical differences in suicide rates. The Rocky Mountain states and Alaska have the highest suicide rates in the United States. Cultural factors, including beliefs and attitudes towards mental health, help seeking, and mistrust of systems, including schools and healthcare providers, can impact risk for individuals, families, and communities. Additionally, experiences of racism and discrimination have been shown in the research to negatively impact mental health outcomes for minoritized groups. Now, this does not mean that if a person belongs to one of these groups, that he or she will automatically think about, attempt, or die by suicide. It just means that, statistically speaking, youth in these groups experience increased risk due to multiple and complicated risk factors. Thus, it's important for schools to understand what puts youth at higher risk and lower risk for suicide. Schools play an important role in reducing suicide risk and should address culture, stigma, and help-seeking behaviors in their district-wide suicide prevention efforts. As I've stated in the beginning, suicide is a complex health-related outcome. It is not caused by a single event, stressor, or risk factor. However, as with many health issues, there are factors that increase and decrease the risk of suicide and suicide attempts. Risk factors are those characteristics that make it more likely that individuals will consider, attempt, or die by suicide. And protective factors are those characteristics that make it less likely that individuals will consider, attempt, or die by suicide. Let's look at a few of these risk and protective factors for youth. On the left side of your screen, you see some risk factors for youth that are common. I want to highlight that in addition to the general risk and protective factors for all people across the age spectrum, family, school, and peer interactions are unique risk factors for youth that should be taken into consideration when developing strategies for intervention within schools. Additionally, districts should also be aware that certain student populations have an elevated risk for suicidal behavior. And these include youth living with mental health and/or substance use disorders, youth who engage in self-harm or have attempted suicide previously, youth in out-of-home placements, youth experiencing homelessness. Again, I want to highlight youth who are American Indian or Alaskan Native, as well as LGBTQ youth, youth who are bereaved by suicide, and youth living with medical conditions and disabilities. There are several effective protective factors, including getting effective mental health care, having connections to individuals, families, and communities, developing effective problem solving and coping skills and life skills, and increasing social connection and support. In addition to risk and protective factors, there are certain warning signs that we need to know and respond to when it comes to youth. And I like to categorize those warning signs into three broad areas. Things that youth may say, so their talk, things that they may do, so their behavior, and things that we may see in their mood or changes in their mood. So talking about wanting to die, whether stated directly or indirectly, talking about feeling trapped or having no hope, changes in their behavior where they might engage in more risk-taking behaviors. Maybe they're more isolated from their peers and friends. Changes in their mood, maybe increased irritability, sleeping or eating too much, feelings of sadness and anger. Any behavior change that you see that is different or unique to that person or individual could alert you to the increased risk for suicide. I want you to also keep in mind that youth communicate in many different ways. Any of these warning signs could be observed, read, overheard, text, or even posted on social media. And because suicide is about life and death, trust your instincts, trust your gut, and investigate any third-party information or rumors that you might hear. It is better to err on the side of caution than to miss an opportunity to intervene and save a life. Since many staff in schools may not know what to do if they see a student exhibiting these warning signs, schools do need to have procedures in place for how staff and students should respond if they see any warning signs. There are some things that schools can do, and those things are highlighted here. Schools have an opportunity to minimize risk factors and to increase protective factors. And although this list is not exhaustive, it's helpful for us to consider. Schools have an opportunity to offer activities that are alternatives to alcohol and drugs. Schools can put in place programs to enhance coping skills and life skills. It's important also for schools to have formal agreements with mental health agencies and substance abuse agencies within their communities to support students and families who are in need of those services. It's also important that schools take time to connect and embrace the diversity of students and families that they serve in their community. And making sure that suicide prevention is a key component and a part of the school's overall wellness plan is so very important. Many of the programs that schools already offer, such as bullying prevention and substance use and violence prevention programs, are part of an overall effort to reduce risk factors and build protective factors, and can be part of a comprehensive suicide prevention plan. We know that this has been a very tough, and that is an understatement, time for all of us, the past 18 months especially. And as schools began to transition back into in-person learning this school year, and we are still dealing with ongoing health and social crises, students and staff and parents are returning to school very different than when we left. And our collective goal, well, is to support one another and to reestablish our school communities. In their Back to School Childhood Trauma Learning Collaborative Toolkit, the Great Lakes Mental Health Technology Transfer Center offered these 7 strategies for schools to consider as they plan for return to school this fall. Prioritizing the mental health of students is essential, and doing so requires that districts identify and respond to students who may be at risk for suicide, as well as be prepared to respond to a suicide death. As I mentioned when we started, SAMHSA has a toolkit called Preventing Suicide, a toolkit for high schools that outline the reasons schools should address suicide. Keep in mind that maintaining a safe school environment is part of a school district's overall mission. Schools have an implicit contract with parents to protect the safety of our children while they're in your care. And suicide prevention is consistent with many efforts to promote and protect student safety. I remember back in 2020, when the pandemic first started, I remember receiving a call from my son's 8th grade teacher. She reached out to me because she was concerned because my son had not been engaging in the online learning. And I guess the school had some sort of technology where they could see when students were engaged. So I received a call, a pretty panicked and very concerned call from his 8th grade teacher, saying that she was concerned about him and that she wanted to set some time up to talk with him and to have a meeting with us. And I remember her saying that she needed to see him, that she knows him, and she needed to make sure he was okay. Now, as a mother, that startled me, but at the same time, it gave me comfort, because even in the midst of everything that the teacher was going through, that she thought enough of my son and probably other students to notice a change in his behavior. And she reached out, made the connection, and it meant so much to us, and it meant a lot to him. And so it's important to understand the role that educators play in connecting with students, identifying problems before there's a problem, reaching out and making sure that students have the support that they need. We know that suicide is a second leading cause of death for youth. We also know that students' mental health can affect their academic performance. The tragedy of school suicide can have a lasting impact on a school community. And for vulnerable students, suicide contagion is a very real phenomenon. It's estimated that between 1% and 5% of all teen suicides, contagion is a relevant factor. Contagion can occur by exposure to a peer who attempts suicide or dies by suicide. It also can result from the way media covers a celebrity suicide, or through graphic or sensationalized visual images or language in the media about suicide. Thus, it's important that schools message suicide deaths and attempts appropriately to minimize the impact and that contagion can have for vulnerable students. And perhaps most importantly, school staff play a role in identifying and responding to suicide risk in students. As an educator, you have a very important role to play. Your day-to-day contact with students allows you to observe their behavior and act when you suspect a student may be at risk of suicide. But the reality is that taking action if you see someone exhibiting warning signs is not always easy. So it's important for us to acknowledge that many people, even educators, are hesitant to get involved with a student who might be suicidal. The shame and stigma of suicide and mental health problems can prevent us from talking about suicide openly. We might even be uncertain of what to say or what to do. Schools also fear liability in having some of these discussions and implementing suicide prevention strategies. We also may fear that the person may get upset or angry with us or be embarrassed by our outreach efforts. Youth who think about suicide might be afraid to talk about it for the same reasons that we hesitate to reach out. Shame, appearing weak, the stigma, how people will think of them negatively, fear that no one cares, or concern about putting them in an awkward position or making them feel uncomfortable. In spite of the stigma and fear, it's imperative to respond immediately when we see a student showing any warning signs, or when we hear information from another student, or even have a gut instinct. It may be a matter of life or death. Asking about suicide does not cause someone to think about suicide. It shows that you care and that you are a trusted source of support. It also helps to break down the isolation the student feels, and it opens up the conversation so that the student can get help. Whenever you suspect or know that someone is thinking about suicide, tell them that you care about them and their safety. Always take it seriously. Find the appropriate person in your school, which should be identified in your school's protocol. We wouldn't avoid helping someone in a medical emergency, so we shouldn't avoid helping a person with a mental health emergency. And there is hope in the midst of everything that we're talking about. Know that the majority of you thinking about suicide do show warning signs. This means that we can recognize most crises before they turn into suicide deaths. Nearly everyone who thinks about suicide is ambivalent about ending their life. That they are still alive is proof that some part of them does want to live. And most youth who think about suicide don't die by suicide. And with engaged and prepared schools, even fewer would. Showing that you care, offering help, and connecting the youth to help, such as guidance counselors and outside mental health services, builds hope and prevents suicide. So how can schools prevent suicide? Well, a comprehensive school-based suicide prevention program should be built on a number of complementary strategies. And there are two essential components that every school should have in place, regardless of whether or not they're going to implement any additional suicide prevention activities and before engaging in any other suicide prevention activities. And those two things that should be in place are having protocols for helping students at possible risk of suicide and having protocols for responding to a suicide death. The good news is that more schools are engaged in suicide prevention efforts than ever before. And if your district is engaging in suicide prevention activities, do you have these two protocols in place? Are they written, reviewed, and distributed annually to staff? Are they shared with parents? A comprehensive suicide-based, a comprehensive school-based suicide prevention program should be built on a foundation that responds to the most serious issues faced by students in the school, which is a student who is at high risk of suicide and a death by suicide of a student, which, as we've mentioned, that death of a student by suicide could actually place other vulnerable students at an increased risk. After developing the above two protocols, all staff should be engaged in suicide prevention through education, educating staff about the importance of suicide prevention and training staff to recognize risk. After staff education is put in place as part of the comprehensive plan, the school is ready to implement additional suicide prevention activities that include educating parents, students, and screening students for suicide risk. Identifying students who are at risk of suicide will be more likely to prevent suicide when the procedures that ensure these students receive appropriate services are in place. Keep in mind that only after creating these procedures is a school ready to implement other suicide prevention efforts. The importance of staff education and parent training cannot be overemphasized. Staff should be trained in the warning signs of suicide and identifying students at possible risk of suicide. Also, understanding what your state mandates in terms of training in suicide prevention is very important. Education should include your school resource staff, such as counselors, social workers, nurses, psychologists, cafeteria workers, bus drivers. And there are certain staff in your school that might need specialized training on how to intervene with, how to assess, and manage students who are thinking about suicide once they've been identified. Schools need to have these protocols in place prior to educating staff and parents. So very important. These protocols, as I mentioned before, must include agreements with outside mental health providers. A crisis team should be in place within your school district to respond to suicide attempts and death. The training for staff is not a one and done. This should include an annual training for all faculty, staff, administrators, office staff, athletic staff, cafeteria staff, transportation staff, classroom volunteers, etc. This training can save lives. Additionally, having parents involved is an important way to ensure that your efforts target the needs of the community that you serve and enhances the cultural competency of the school-led efforts. Parents, guardians, and other adult community members who receive suicide education training should be well aware of the risk factors, the prevalence of suicide, how to respond, and where to turn to for help. Another component that's part of the comprehensive suicide prevention plan is educating students. Having developmentally appropriate, student-centered, culturally and linguistically relevant education materials that are integrated into the curriculum for all K-12 health classes is one approach to take. The content of these age-appropriate materials should include the importance of safe and healthy choices and coping strategies, how to recognize risk factors and warning signs of mental health disorders and suicide in oneself and in others, as well as focusing on help-seeking strategies for oneself or others, including how to engage with school resources and refer friends for help. The curricula for students, for all students, or universal curriculum should provide information about suicide prevention. We've talked about protective and risk factors, promote positive attitudes, increase students' ability to recognize their own risk and risk in others, and encourage them to seek help. You also have programs that are skill building where you can target at-risk students or groups at an increased risk for suicide and focus on building their coping skills and problem-solving skills and cognitive skills, addressing problems that can lead to suicide, such as depression and other mental health issues, anger, and drug use. And then there are peer-led programs for groups of individual students. And these teach selected students leadership skills and those skills that are needed to help students at risk. This empowers selected students so that they can take action to improve the school environment. Many times, schools jump to screening for risk without having protocols and without adequately educating staff and parents. And that is not recommended. And when screening for suicide risk, it's important, and I've mentioned this several times, to have the resources in place and the systems in place to connect anyone that's identified as being at risk to appropriate follow-up care and assistance. And I want to take a moment to share an example. Here in Illinois, I had the opportunity to work with an organization called Alyssa's Mission. And Alyssa's Mission is working in several, probably hundreds of school districts in the state of Illinois. And they provide training and support for students, for staff, and for parents. And their approach is building the capacity of schools to understand and prioritize mental health and suicide prevention. And one of the things that they do with their program is that when they're working with the school, they connect with resources in the community to support that school by notifying those community resources that they are providing training and that they're doing screenings so that the community providers can be aware that they might get calls. They've also invited crisis services to be on staff available on the days that they're providing the programs in the schools. And I think that that is really a best practice model that schools can use, that you have available resources for students who are identified at risk when employing any type of screening and education program. Now, there is a difference between screening and assessment. This often comes up with schools, and so it's important for us to make a distinction here. Screening is a procedure in which a standardized tool, instrument, or procedure is used to identify individuals who may be at risk of suicide. There are several screening instruments that schools might be using and might be aware of. And frankly, it can get very overwhelming when looking at screening tools that are available. And screening differs from assessment. Assessment is a more comprehensive evaluation to confirm suspected suicide risk in an individual. And it allows for you to determine risk and immediate needs of that individual that's being assessed and decide on a course of treatment. An assessment is only performed by an individual with clinical expertise. And so it's important that when schools are preparing to develop a school-based plan, that you understand the difference between screening and assessment. And if you decide as a district to do both, that there is advanced training that individuals who are qualified mental health professionals can take so that they can conduct the assessment, or you can partner with community organizations in your local community who provide assessments and have those formal agreements so that once you've screened students or you've identified a student who's at risk, then you can make a seamless referral to that community provider to do a full assessment for that student. In developing your protocols, it's important to make sure that there are reentry procedures in place. I used to work at a behavioral health hospital, and we worked with a lot of schools in our community with students who were hospitalized, and then they would be returning to school. Some schools had very strong reentry procedures that were based on best practice tools. The SAMHSA guide offers strategies. There are also a few other resources, such as the Model School District Policy on Suicide Prevention that you see here, that outlines very comprehensive strategies that schools should employ as students are transitioning back to school if they've been out of school to deal with their mental health issues or have been hospitalized for an extended period of time. And so it's important that you have those reentry procedures, that they're written, that they're distributed, and that everyone in the school understands what those procedures are. A few things I just want to highlight for the model district policy that we've been talking about. It's important that you understand that these policies, these model policies, should include not only prevention activities, but intervention and postvention strategies as well. Postvention is prevention. Schools must have strategies in place, policies and procedures in place to address all three areas: prevention, intervention, and postvention. So Jonathan Singer is the president of the American Association of Suicidology, and I included this quote here that I will read because I think it's important as we look at the role that culture plays in our suicide prevention efforts. The work of suicide prevention is grounded in the assumption that people live in a world that believes their life matters. For many people of color, however, they do not see that world as their own. On a practical, daily level, society gives explicit and implicit messages that it's white lives that matter and not Black lives or brown or indigenous lives. And as you look at your strategies for suicide prevention in your district, you have to consider the implications of race, ethnicity, and culture on suicide prevention among Black, indigenous, and other minoritized groups. Consider that for some groups, calling 911 is seen as help and it's welcomed. For other groups, not so much. And so as you're looking at your suicide prevention plan and strategies within the district, you must take into consideration these cultural factors in your planning. And the most effective way to do so is to make sure that you have the right people at the table to help inform and guide you through the process. Making sure that your strategies are centered on the needs of all students and families in your community is so very important because we want to save all lives and not just certain lives. We do know that there are differences, cultural differences in the way risk and protective factors are manifested. Also, the precipitants of suicidal behavior can be different based on cultural and language needs. The understanding and expression of warning signs, help-seeking behaviors, and as we've mentioned before, trust and or mistrust of school personnel and health and mental health care professionals needs to be considered. So with all of that, how do you get started? How do you build capacity for your efforts and get buy-in? What are some of the barriers and challenges that you face as a school district? And so I'm interested in hearing from you all who are here with us today to share what are some of those barriers that you face as a school district in implementing or developing suicide prevention strategies. If you wouldn't mind putting your comments, and I think in the Q&A or in the chat, and we will interested in your feedback.
Yeah, go ahead and put any questions or anything you have in the Q&A. Just
Yes.
make it a little easier, and then we'll read those out. We'll give you all a moment to do that if you have any questions or comments.
Think about some of the barriers that you face as a school district in implementing suicide prevention strategies. Anyone have any they want to share? It's a subject that they are scared of. The school district being afraid and hesitant, I assume. Anyone else want to share? I hear that one frequently. And the fear of addressing suicide in the school district is steeped in a lot of misconceptions, you know, that talking about it will somehow put the idea in students' minds, questions about liability. And those are very real questions about liability, but understand that school districts have been sued for not protecting students and not doing things to put supports in place for students who are struggling. And so it's worthwhile to have this conversation. I will share with you a few of the barriers that I have heard come up from school districts in my work with them. And you let me know if some of these resonate with you. Here's another one here: constantly having to be reactive instead of getting to be proactive. You know, last spring, we did a learning collaborative with several school districts across 6 states, and that barrier was something that was common with everyone that was involved. And they all said that their districts tend to be reactive than proactive. That is definitely a barrier that, you know, school districts only tend to respond after something happens. And everything that I've said that have been outlined in the toolkits that we will use, that we're using today and that we'll use for the project that we're starting next month, identify the importance of prevention, and that suicide prevention, if we employ strategies to prevent suicide, we can save lives. Other barriers include time and resources. Someone else says school districts are not letting guest speakers into the schools. So yes, the pandemic has definitely created some challenges, right, for us to get subject matter experts and people within the school that can help. And so those are very real barriers that we deal with, including time and resources, stigma, having administrative support. You know, you have to have buy-in from your administration to prioritize this work. One of the other barriers that we heard, and I often hear, is limited community resources. You know, in some communities are resource poor. Some more rural communities have less resources available. Also, accessibility of those resources and funding for those resources for families who may not have the means to access the resources. Your school culture and values surrounding suicide prevention are all barriers that schools face, and it makes this work hard. So it's one thing to know what to do, right, to prevent suicide in schools, but it's another thing to be able to move the needle and to implement, right, these evidence-informed best practice strategies within a school district. And so one of the ways that you can get started to creating that sustainable change is to start by engaging your administration and your key stakeholders. And that includes not only your district leaders, but building leaders, parents, community members, as well as students, and understand the resources within your state and your county and your district, and getting an understanding of what the mental health needs are of students in the district. The CDC has a website where you can look up state data around mental health and suicide. You can even drill down to a little bit of local data, and many schools have access to surveys that they've done and have school-specific data from the Youth Risk Behavior Survey. So showing the need in your community around mental health and suicide prevention is one way to get the support of your district, your board, your building leaders, your parents, your students, and your community. It's also important that you assess your current policies, programs, and school culture. And by doing these strategies, then you can begin to develop your overall strategy and activities. Now, it's important, what I find is that many schools don't have the policies in place. And so this slide highlights the importance of having protocols for helping students at risk. Does your school have a written protocol for helping students who may be at risk? Do you have a written protocol for responding to students who attempt suicide at school that is consistent with the best practice guidelines outlined in the toolkit? Do you have written protocol for responding to suicide of a student or other member of the school community that is, again, consistent with the guidelines? And do you have staff who will implement the suicide response protocol and are familiar with that protocol and the tools that will help them fulfill their responsibilities? A best practice tip is having a suicide prevention task force that is made up of administrators, board members, building leaders, parents, students, and community members who have expertise and knowledge of suicide prevention in youth. Every school district should also have a suicide prevention coordinator who will make sure that the school district complies and follows the guidelines, and also is the point person for when there is a crisis that needs a coordinated response. So to address some of the barriers that districts often face when implementing change, we are inviting districts to participate in a year-long school-based suicide prevention learning collaborative that is designed to help school districts overcome some of these barriers by applying the process improvement principles of NIATEC to their current suicide prevention policies, with the goal of enhancing their comprehensive suicide prevention plan. And so to explain the NIATEC process improvement, we are going to watch a very brief video that explains what that work looks like.
At NIATEC, one of the main things we do is to teach process improvement to behavioral health and human service professionals. Now, we've been known to explain our entire model of process improvement to folks over lunch. It's that simple. Here's how it works. Whenever you want to make a change or improve something in your organization, you start a change project. Now, every change project has one aim. Think of the aim as the target. It's that specific measurable goal you're trying to achieve. Now, to carry out a change project, you need people and some tools. On the people side, we emphasize three key roles. The executive sponsor, they're often a senior leader in the organization, and they help remove barriers for the project. The change leader is the project owner, and they lead and coordinate the change team, which is a group of staff members selected to work on the change project. Now, when it comes to process improvement tools, the NIATEX model focuses on 4 that we found to be easy to learn and effective for most change projects. The walkthrough is a tool to help you experience a process just as your customer would. Flowcharting creates an actual picture of the process from beginning to end. The nominal group technique, this is a tool the change team uses to brainstorm ideas that will help achieve the aim of the change project. And the PDSA, which is an acronym for Plan, Do, Study, Act, is an efficient way to test changes. Rapid cycle testing, that simply allows the change team to try a change for a short period of time to see if it's an improvement. Finally, the NIATEX model has 3 rules for change leaders and their teams to follow when conducting a change project. 1 is to use existing resources. The goal is to achieve your change project aim using currently available staff and materials. 2 is to measure change. Simple measures are the lifeblood of successful change projects. So collect only the information you need to achieve your project aim. And 3 is to sustain the gains. Now, once you've achieved your aim and the change project ends, you must have a plan in place to monitor your measures and intervene if they creep back to unacceptable levels. That's it, the entire NIATEX model of process improvement. Now, to gain a deeper understanding of process improvement and the NIATEX approach, view our online course, Process Improvement 101, at niatex.net.
So the Schoolbased Suicide Prevention Learning Collaborative is designed to help school districts apply process improvement principles to their current suicide prevention policies, again, with the goal of enhancing their comprehensive suicide plans district-wide. Districts are going to use existing resources to develop measurable and sustainable district-wide prevention plan. Each participating district will need a district leader or executive sponsor who will be able to remove any barriers, and a change leader. That might be a social worker, psychologist, wellness coordinator, et cetera, at the school level. There is an application process, and district teams will be chosen based on their readiness for change and level of commitment. The Learning Collaborative starts Wednesday, the date is wrong, October 13th, Wednesday, October 13th, and will run through May 4th. It starts October 13th. We will be meeting weekly for Learning Collaborative sessions. We will be employing the NIATEC model of process improvement. So we will have a Change Leader Academy in February. We will also have group and individual coaching sessions. And on the final day, we will do presentations of your change projects to the group and the individuals in the Learning Collaborative. This is a year-long school-based suicide prevention learning collaborative that we are extending an invitation to you and your districts to participate as part of this project. I am now going to pause for any questions that there may be or comments. And Anne, I think you might be helping with filtering some of those.
We do. Yep, we have one question. And again, encourage anyone who has questions for Tandra to please put them in the Q&A. Has your area set up what is known as a peer support in public schools to help students struggling with emotional and mental problems?
I am aware of peer support programs in various school districts. Peer support is a very effective support mechanism that schools can adopt as part of an overall strategy. It can have a very positive impact on school climate and culture. So yes, that is one of the among many strategies that schools can employ to support students who are at risk and who are struggling.
Great, thank you. We do not have any questions in the Q&A right now. Just a couple quick reminders. The Learning Collaborative starts on October 13th. Applications must be submitted by the 6th of October. And Sarah also put her email in the chat. So if you have any questions, please contact Sarah McMinn, and she will be happy to walk you through the process or answer any questions that you have. I want to again thank you, Tandra, for this incredible presentation. As always, we learn a lot. And we will be sending, you'll get a link to the survey after you log off. So thanks for asking. But if anybody has any other questions, you can feel free to contact Sarah. And I want to thank all of you for your time this morning, and especially you, Tandra. Thank you very much.
No, thank you for the opportunity, and thank you all for joining us this morning and for your efforts to address suicide. And we look forward. Please reach out with any questions. And if you're interested in participating in the Learning Collaborative, we would love to have you. Thank you so very much.
Hi, everyone.
Bye.